Hey guys, this is Fixer Med. Welcome back to my high-yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering a broad overview of the discipline of anatomy across various organ blocks for these examinations. This will be part 58 of my multi-part video series of doing so. Without any further delay, let's go ahead and get started on today's content. Let's start off by taking a look at Abducens Nerve Palsy, also known as internal squint, also known as sixth nerve palsy. Injury to the abducens nerve causes paralysis of the lateral rectus muscle, leading to an inability to abduct the affected eye. As a result, the affected eye is fully adducted due to the unopposed action of the medial rectus muscle, which is innervated by cranial nerve 3. Let's next take a look at the corneal reflex, also known as blink reflex or eyelid reflex. Affects most extraocular muscles. Manifestations: ptosis, fully dilated pupil. Eye is fully depressed and abducted, down and out, due to unopposed actions of the superior oblique and lateral rectus muscles. Let's next take a look at Horner syndrome. Horner syndrome can result from a penetrating neck injury, Pancoast tumor, or thyroid carcinoma that interrupts ascending preganglionic sympathetic fibers between their origin in the upper thoracic spinal cord and their synapse in the superior cervical ganglion. Signs of Horner syndrome include constriction of the pupil, miosis, drooping of the superior eyelid, ptosis, redness and increased temperature of the skin, vasodilation, absence of sweating, anhidrosis. All right, guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far. A 38-year-old man presents with double vision and difficulty moving his right eye. On examination, his right eye is unable to move laterally and appears to be deviated medially when looking straight ahead. Which of the following cranial nerves is most likely affected? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is D, abducens nerve. The abducens nerve, cranial nerve 6, innervates the lateral rectus muscle, which is responsible for abducting the eye. Injury to the abducens nerve results in paralysis of the lateral rectus muscle, causing the affected eye to be unable to move laterally and to be pulled medially by the unopposed action of the medial rectus muscle, which is innervated by the oculomotor nerve, cranial nerve 3. This results in a characteristic internal squint and horizontal diplopia. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. The optic nerve is involved in vision and does not control eye movements. Damage to this nerve would result in vision loss, not an inability to move the eye laterally. B. The trochlear nerve innervates the superior oblique muscle, which is responsible for depressing and entorting the eye. Its palsy would cause difficulty looking down and medially, not laterally. C. The oculomotor nerve innervates most of the extraocular muscles, excluding the lateral rectus and superior oblique. Its palsy would cause ptosis, a dilated pupil, and the eye being down and out, not an inability to move the eye laterally. E. The facial nerve controls the muscles of facial expression and does not affect eye movement. Damage to this nerve would result in facial muscle weakness, not an inability to move the eye laterally. All right, now that we have covered this question, let's move on to look at the next question. A 55-year-old woman comes to the clinic complaining of dryness and irritation in her right eye. Upon examination, you notice that touching the cornea with a cotton wisp fails to elicit a blink reflex in the right eye, while the left eye responds normally. Which of the following nerves is most likely impaired? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is D, facial nerve, cranial nerve 7. The facial nerve, cranial nerve 7, is responsible for the motor component of the corneal reflex, which triggers the orbicularis oculi muscle to close the eyelid. Impairment of the facial nerve can result in the absence of the blink reflex despite normal sensory input from the trigeminal nerve, cranial nerve V1. Therefore, the lack of a blink response in the right eye suggests an issue with the motor function of the facial nerve on that side. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. The optic nerve, cranial nerve 2, is involved in vision and is not responsible for the corneal reflex. B. The oculomotor nerve, cranial nerve 3, controls most of the eye's movements and the pupil's response to light, but does not play a role in the corneal reflex. C. The trigeminal nerve, cranial nerve 5, specifically the ophthalmic branch, CNV1, provides the sensory input for the corneal reflex. Since the left eye responds normally, the sensory input from CNV1 is likely intact. E. The abducens nerve, cranial nerve 6, controls the lateral rectus muscle for eye abduction and does not participate in the corneal reflex. All right, now that we have covered this question, let's move on to look at the next question. A 40-year-old man presents with drooping of the left eyelid, constriction of the left pupil, and lack of sweating on the left side of his face. He reports these symptoms started after sustaining a penetrating injury to his neck. Which of the following is the most likely diagnosis? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is D. Horner syndrome. Horner syndrome results from disruption of the sympathetic pathways that control the eye and facial structures. It is characterized by ptosis, drooping eyelid, miosis, constriction of the pupil, and anhidrosis, lack of sweating, on the affected side of the face. These symptoms align with the patient's presentation, especially considering the history of a neck injury, which could interrupt the sympathetic fibers. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A. Oculomotor nerve palsy typically presents with ptosis, a down and out eye position, and a dilated pupil due to loss of parasympathetic innervation, which does not match the patient's symptoms of miosis and anhidrosis. B. Trochlear nerve palsy causes vertical diplopia and difficulty looking down and in without affecting pupil size or facial sweating. C. Abducens nerve palsy results in an inability to abduct the eye, leading to horizontal diplopia but does not cause ptosis, miosis, or anhidrosis. E. Bell's palsy affects the facial nerve, leading to unilateral facial muscle paralysis, but does not involve changes in pupil size or sweating, making it an unlikely diagnosis for this presentation. All right, guys, that is all I have for the video today. As always, be sure to leave a like and subscribe to the channel for more videos like this if they are beneficial to you. If you have any questions, comments, or concerns, please feel free to type them up in the comment section below. Anyways, guys, this is FixerMed signing off. Be sure to have a great day, everyone. Good luck studying as always, and goodbye.